bienvenue à tous. Merci d'être là. Merci aussi à l'ISPED et à ISPED BPH de nous accueillir dans cet amphibier qui est vraiment... J'ai des retours, je pense que c'est via Zoom. Merci de nous accueillir dans cet espace qui est vraiment lumineux, accueillant. Merci beaucoup. Donc juste peut-être quelques mots pour vous dire que cette conférence s'inscrit dans les travaux menés par la chaire médecine narrative hospitalité en santé, qui est portée à la fois par le CHU de Bordeaux et par l'Université de Bordeaux. Et elle s'inscrit plus précisément dans le cadre d'une semaine qui a été riche en événements. Et je me permets de m'arrêter juste 2 minutes sur cette semaine qui a été très dense, puisque nous avons d'une part accueilli dans le cadre d'un programme qui s'intitule Médecine narrative en pédiatrie, qui est soutenu par la Fondation de France et par l'ARS, une double résidence recherche et littérature. C'est-à-dire que pendant une semaine, nous avons accueilli Loïc Bourdeau, qui est maître de conférence à l'Université de Maynooth en Irlande, mais aussi Camille Laurence, qui est écrivaine, que vous avez dû lire. Donc, ils ont été tous deux pendant une semaine dans le cadre du pôle de pédiatrie pour travailler avec les personnels hospitaliers. Donc, d'une part, cette première résidence, mais aussi un croisement avec une autre résidence qu'on accueille dans le cadre de la chaire médecine narrative, qui est une résidence, qui est un compagnonnage avec Thibaut Martouré, qui est... professeur d'anglais, mais qui est surtout poète. Et c'est dans ce contexte que nous l'accueillons dans le cadre de la chaire. Donc, pour le déroulé de la conférence, Loïc va modérer donc, les échanges qui vont suivre la conférence de Rita. Et nous aurons donc 3 discutants, Olivier Brissot, Jennifer Duchesne et Fiona Giléon. Mais je m'empresse de vous présenter Rita CHARON. Déjà vous dire que c'est une joie et un honneur de pouvoir accueillir Rita CHARON parmi nous. Rita CHARON donc, a la double casquette de docteur en littérature et de docteur en médecine, ce qui n'est pas si courant que ça, et donc il faut le préciser. Rita CHARON est à l'origine de la médecine narrative, puisqu'elle a fondé et elle dirige le département des sciences humaines et de l'éthique médicale à Columbia University, et elle est aussi professeure de médecine à Columbia. Et aujourd'hui, Rita nous propose donc une conférence en anglais sur, je traduis le titre, mais la conférence va se dérouler en anglais. La conférence donc porte le titre « La portée interprofessionnelle des pratiques narratives au-delà de la médecine narrative vers des soins centrés sur le patient ». Rita, thank you so much.
Thank you. Thank you also for the privilege of speaking to you in English. Is that okay? For you, that's okay. I'm thrilled to have in one room persons who work in healthcare, les soignants, qui sont les médecins, les infirmiers, the doctors, the nurses, the social workers, the administrators, critical. The students, I know there are some masters in public health students here, and the terrible limits that are placed on the quality of the care we can provide because we do not speak very well with one another. Vous savez qu'il y a un grand problème entre les médecins, les infirmières, et les physiatrices. And this we have a chance to fix. Oui? Alors, je veux dire, voilà. I want to tell you first how we have developed the connections among the different professions at Columbia, and which professions we are uniting. Then I'm going to tell you a little bit about efforts in France to bring these professions together. And then, that's not going to take very long. And then I'm going to ask you to join me in doing some narrative medicine work. So you're going to work with me. I hope you don't mind not only speaking, but writing and doing some actual narrative work with us, so that you get a sense of what happens when we bring the forms of creativity and discovery to bear on uniting our different perspectives. Yes? Okay. So at Columbia, we have gathered together by now 10 different professions. And it's dentistry, nursing, medicine, public health, occupational therapy, physical therapy, nutrition, chaplaincy, and social work. I think I maybe forgot one. But you see the range of disciplines involved. And we make sure that students from all of those backgrounds learn together. And we have seminars in aging and end of life. We have a seminar in healthcare justice. We have a seminar in spirituality and health. But gathering all these students from all these different disciplines. And for the first time, they find out what, in fact, they share and what, in fact, they don't share at all. So the kind of work that happens entre les professions, it is in pediatrics, especially in the child abuse service. Vous savez, quand les enfants sont injured. Disability studies, c'est quelque chose que vous faites ici? Si. The end of life, palliative care, for sure. And also the social public health justice issues of how poverty, race, class, neighborhood, where you live, will dramatically interfere in your capacity to be healthy. And so we see these methods of narrative medicine being put to work in things like pediatric patients with very complex care, many different diseases. Do you see? Congenital disease, heart surgery, very seriously ill children. And we find our methods help to get the team together. Doctors, nurses, social workers, speech therapists, psychologists, educators, parents. And they're able, with these methods, to not only communicate, but to appreciate one another's perspective. Here in Paris, SAMU Social, vous savez, SAMU Social, I worked yesterday with a group, one of whom took your diplôme in narrative medicine, teaching the persons who are undomiciled, persons without homes. And they get mostly the women together, and they use these methods of narrative medicine to enable these women who come from many, many countries, many in Africa, as well as many areas in Paris who have no home. And it's through these methods that these women become able to not only hear one another, but appreciate what they share. And the different, you'll hear me use the word perspective 100 times today, to appreciate these perspectives from outside. So I'm going to just depend on a metaphor with you today. The metaphor is the horizon. En français, c'est un horizon. The dividing line between what you can see and what you can't see. Yes? And that will help us talk about perspective. Each of us is confined to a particular horizon through language, through class, through interest. You can see some things, but you can't see other things, simply from where you are placed. Your feet are on the ground somewhere. Okay. So, but each horizon hides some things, doesn't it? Because it's down below. And you have to wait kind of for the sun to rise before you're able to see it. Yeah? So the horizon helps us know literally where we're located. What is the center here? What is this scene about? And I borrow the horizon from Hans-Georg Gadamer, the philosopher from Germany, who uses this metaphor. How do you say? I poached it. Qu'est-ce que, en français, I stole it. J'ai volé. Oui, emprunté, mais volé de Hans-Georg Gadamer. L'image de horizon. And he says, each of us has a horizon that limits what we can see. For Hans-Georg Gadamer, intersubjectivity means merging your horizon with another person. So each of us has our own horizon, and yet as relation develops, we are able to join, we are able to merge these horizons so that even briefly, I can see what you can see, and you can see what I can see. Sometimes very quickly, whoop, boom, whoop, boom. Do you see? But that is the goal of interprofessional work. That we're able, and it takes work, we're able to at least briefly leave our horizon and join with what the other person or group sees. And of course, this is the goal in caring for individual patients, caring for individual families, to at least fleetingly, little time, to see from their point of view what matters. That's the goal. Okay, so I'm going to show you some pictures. And I hope it might be too light in here, but let's try. Can you see that? What do you see? Dites-moi, what do you see? Holler. Tell me what you see. Où sommes-nous? Huh? We're on the moon. We're on the moon. This is 1971, Apollo. they're standing on the moon, and they're looking at Earth. And they maybe say to themselves, they say to one another, oh, isn't the Earth nice tonight? Oh, I haven't seen the Earth in a while. Right? And it's a bit dizzying. Dizzy. Come on, in French. Yeah. And we say, wait a minute, I'm not the center anymore. Where I am is not the center. I am de-centered by virtue of this image. The Earth has become a minor detail. Who knows, on the moon there may be several moons, right? I bet we don't have an astronomer with us. So our planet is no longer the center. And isn't this what happens with our professions? That everybody thinks they're the center. And then there was a study in the adult intensive care unit at Columbia. An anthropologist did a qualitative study of the rounds, where all les équipes go to each patient's room, and they describe what happened overnight, and they make the plans for the next day, and they go in and they talk to the patient. And what did the anthropologist find? The doctors were the only ones who talked. The nurses never talked. This is not uncommon, right? Or the social worker writes very detailed notes in the chart, and nobody reads them. Oh, that's too long. Do you see? So we understand what it means to feel like a minor part of something that belongs to others. Does this ring a bell? Does this make sense to you? That you feel like a minor part, un petit partie de quelque chose grand. Mais le grand thing n'appartient pas à vous. Is that how to say it doesn't belong to you? Huh? Okay. I'm going to show you another horizon. Do you see that? Is it dark enough in this room you can see that? Okay. I'm going to give you a couple of minutes. Just look at this. Are you familiar with this painting? Okay. Just look at it for a couple of minutes. Just look at it and see where it brings you. Now I'm going to take a chance. I'm going to ask you to write down 3, 4, 5 words, maybe a sentence, 3, 4, 5 words. What do you see? And what is the mood? Je crois qu'en français, le mot est humeur. Humeur. Quelle est humeur de cette image? What do you see? Et quelle est humeur? Go ahead. C'est pas compliqué, seulement un peu des mots. OK? Merci pour écrire. Et maintenant, je veux entendre ce que vous avez écrit. Est-ce que quelqu'un veut dire qu'est-ce que vous avez écrit pour les tous? Will you read aloud what you've just written? Please.
I can identify with the person in the scenery.
Yes.
A lonely walk on the beach, maybe. I'm part of the landscape. I become water, sand.
Yes.
I feel interconnected.
Yes.
And at the same time, I disappear.
And then you disappear. Voyez-vous, there are opposites there. There's great tension there because you're both unified with the elements, with the sea, with the sand. And you kind of disappear. Now, do you see what she did in, what did I give you, 45 seconds? Maybe 60? Let me hear somebody else.
I have something quite similar. I have spectral presence / absence. Study in sand and water, and pleasant melancholy.
Ah. Okay, so do you see the difference here? If you were merging your horizons, you would have more of the tension that we heard at the beginning. And you would have more of the comfort. There's a more comforting, a pleasant nostalgia, a pleasant melancholy. So can you all see the distance between those two? And how it would take some effort to, if you were working together, you would say, tell me more. Yeah? One more, and then we'll go on. One more. This is great, thank you. Now, notice that the figure, peut-être c'est un homme, je ne sais pas, but the figure is disappearing. Do you see that? And so we have to this is Whistler in 1865. It's called La mer et la pluie is the name of it. But the man is like kind of disappearing, or maybe he's appearing. We don't know. And when I saw this the first time, this painting, I couldn't tell whether the figure was just an afterthought. You know, maybe Whistler said, oh, I better put a figure there for proportion. Was it an afterthought, on the one hand, where the figure is totally dismissible, or all this sea and all this sky is there for the one guy, right? Right? It's there for the one guy. So think of that existential leap from you are insignificant, you don't really matter, all the way to the world is here for you. Right? Okay, that's what we're able to get from these images. Thank you very much for those of you brave enough to read what you wrote. I love it. And that these are the kinds of things that we do in narrative medicine teaching. And if you were in class with me, we would spend 45 minutes with this image, and we would hear what everyone had written. And they would remember from last week what they wrote about another horizon. Here, I'm going to show you another one. Ooh. Ooh. All right, I'm keeping track of time. Any one person just want to shout out what they see? Go ahead. Say again? Contrast, indeed. The top is maybe sky, the bottom is maybe water, right? But it's very drastic, right? The horizon is not usually right in the middle of an image, is it? It's funny to see it in the middle. It's usually near the bottom, near the top. This is unusual. This is Hiroshi Sugimoto, a Japanese photographer, and the name of it is the Sea of Marmara. This is Istanbul. And when I was in Istanbul, they brought me on a bridge. They said, "We're now leaving Europe. We're going to Asia. We're still in Istanbul." And I said, "What is this water we're crossing?" It was the Sea of Marmara. So this image with the name of it, the Sea of Marmara, captures, you said contrast, captures the enormous contrast between Europe and Asia, even within the unified city of Istanbul. Okay, so you understand my devotion to horizons, that we can locate ourselves somehow by what it is that we see. Now, I'm going to show you some words. I'm going to show you some words to describe what this kind of work can do. We paid attention together to my pictures of horizons. We wrote down some of the things that came to mind. And then we had a very brief capacity to hear one another and to see how one another might differ. Here are the words. These are what I call the movements of narrative medicine. Do you know where narrative medicine kind of came from? Do you understand that? I mean, it kind of developed after a long, long history from classical periods and Hippocratic periods, where the arts and creative work were very prominent in healthcare. And then it kind of left the scene. And it was only recently that the principles of bringing these thoughts and practices from the humanities came back into healthcare. And it was really like the beginning of this century. It was like the 1990s, the 2000s, where the idea of narrative medicine emerged. And it was in London, and it was in New York. And the idea was to bring very concretely the ways of thinking and the practices of literary studies, of philosophy, of history, of social sciences, qualitative social sciences, into the fields of healthcare. And this and we called it narrative medicine at Columbia, because we gathered persons from all of these different areas, along with clinical areas, to say, how can we harness what we know from the humanities to help us in our healthcare? And these three movements were the groundwork that mostly what we want to do is to train these clinical persons in paying radical attention to what patients say. Not just what aches and pains they have, but literally what they convey in their words, in their silences, in their facial expressions, in their emotional state, that the listener, doctor, nurse, social worker, administrator, the listener absorbs without challenging, just absorbs all that that person is saying. And we do it by paying attention to the words themselves. I mean, like somebody reading a novel very closely, we notice the plot, the subplot. We notice the images. We notice the diction, how the language is spoken. We notice when the teller stops talking. All of that. And then the next one is the representation, which is, it doesn't have to be in language. It can be in image. It can be in sound. It can be in dance. But somehow the listener captures, puts a form on what was heard. And that's the way we can not only retain it, but experience it. And then the final one is affiliation, which is what we're after, which is the merging of the horizons. It's the ways in which you can see, I'm pointing to my writer, you can see what she could see that you could not see on your own. And that her sense of essentially defamiliarization there in the beach was expanded by your own sense of kind of comfort. Okay. Here's a picture of attention that I had found years ago. It's a pastel by Marie Cassatt. And all I want you to see is the expression on the face of the listener. Do you see that? It is not judging. It is not pity. It is not sympathy. It's probably not even empathy, no matter whatever we think empathy is. It's a heightened, almost neutral attention. And where's the light in the image? The light comes like over the shoulder of the listener. The listener doesn't block the light, and the light goes onto the face of the teller. Here's another way to explain that, and then I'm going to stop in 6 minutes. This is not the Earth. This is Kepler 186f, which is a very, very distant planet. I want you to see how the planet is rotating into the light. Can you, I wish it was a video and we could see Kepler 186f turning so that the parts in the darkness turn into the light. And that's what we want to happen for a patient in our own light. This gentle, soft light emits from the listener. Do you see that? And I'm not granting the listener these superpowers. It's just how it is. If a listener, doctor, nurse, social worker, administrator, physical therapist, if that listener is capable of achieving the attention we are describing. All right? Okay, so that's it. One more picture. Somebody tell me what you see. Qu'est-ce que vous voyez? Tell me. What do you see? Go ahead. You see the back of somebody, exactly. Looks like a woman, right, with a coiffure. It might be too light in here, I don't know. But you can see she's looking at a forest. She's looking at a forest. She's looking, maybe it could be a river down there. It could be a valley, we don't know. But we can see that she's looking at greenery. But then, where does the greenery occur? Where do we see the greenery? Go ahead. On the painting. It's a photograph, actually. But can you see that there's greenery in her head? Vous voyez? It's in her brain. It's probably in her cerebellum. You see it? You see it? Do you all see it? That the forest has become part of self. The forest has become part of self. That which we see becomes part of self. Yes? It's a radical idea. The photographer is Helen Sear, contemporary. I saw this photograph. I bought it. I bought it. And if you come visit me in New York, you'll see it's in my office. It's there. This is the stamp that what I see in practice becomes part of self. Small. Less than 2 feet by 1.5 feet. Small. Okay, I think I've told you the things I want to tell you. And we will see what the questions are from the audience. But I hope I've given you enough kind of, this is what we do in narrative medicine toward allowing our own, it's a brain, but I mean our own apparatus, yes, to absorb the situation of the person we're caring for. Okay. Thank you.